we're losing 129 people a day in this country. In the city of Manchester, we're losing one person a week at,
Unbelievable.
Minimally. And my question to you is, what would you do in order to secure recovery services for those that have slipped through the cracks of prevention and moved on to treatment?
Thank you very much for your question. It is a crisis here in New Hampshire, and by the way, it is a crisis in Vermont. You may recall our governor gave his State of the Union speech a year ago on this issue, because people think, well, New Hampshire and Vermont, these are rural states, not a problem. You are right, it is a terrible problem. What do we do? For a start, we understand that substance abuse and addiction is a health issue, not a criminal issue. Okay? And when I talk about moving toward universal health care, what I understand that to be, and it is absolutely imperative that it be, is understanding that mental health and addiction is part of health care. And what that means is that when people need treatment, they shouldn't have to wait 3 months. When they need it, they should be able to get it. So that means we need a revolution in this country in mental health care to address the causes of addiction and provide treatment. And I was to a treatment center in Manchester, which is kind of peer-oriented. Former people who had addiction work with other people. That's one approach. There are many other approaches. But the bottom line is we have a very, very serious crisis in this country, and we have got to make sure that when people need the help, they get the help. And the other question that we have to ask is, and it's a tough question, nobody I know knows the answer, why is it? Why is it? One of the reasons, by the way, is I think that doctors are prescribing opiates in a way that they have got to cut back a little bit on. They are giving out a whole lot of pills. A friend of mine got a molar removed. They got 50 very strong pain-killing drugs. And these drugs are rampant. Kids are using them, getting addicted, then getting into heroin. So I think we've got to talk to the pharmaceutical industry about what they're producing, doctors what they're prescribing, and then we have to make treatment available to people when they need it.